Hey y'all, hope everyone is doing well today. I am filming a belated update on my first post-op appointment. I have not been able to get on to film this update yet, so I apologize. If you're new to my channel, my name's Rebecca, and I have been battling breast cancer. I was diagnosed at the beginning of 2024 and completed a regimen of chemotherapy, the TCHP regimen. I completed in June, and then I had a bilateral mastectomy in July, and I have had 5 procedures, surgeries, since then. So I've been basically having a surgery every 2 to 3 weeks since July 18th. So I am HER2 positive, so that means that my regimen starts with the chemo and then goes into surgery, and then there is a radiation component and a targeted therapy, immunotherapy component of Herceptin and Perjeta. I've kind of gone through that in my previous videos, so if you haven't seen any of them, they'll kind of catch you up to where we are today, where I just had surgery last Thursday, and because my incisions have not been healing the way that they need to be healing. So last Thursday, they on my right side, they exchanged the existing expander to a smaller one, and closed me up again. I filmed a couple of videos since then on basically how it's been driving me crazy and my mental health on all of that, and seeing my body and all of that. So I've already talked about that. I really just kind of want to catch you up on how my appointment went on Tuesday. And I met with my surgeon and my nurse practitioner on Tuesday, and I expressed the concerns that I've voiced in my previous video about the fact that I look flat on this side, on my right side, and that was something that I had been trying to avoid, which is why I had a bilateral mastectomy in the first place, one of the reasons, and just frustration with everything. And I did express those concerns. I don't know that I was really heard the way that I want to be heard, but I don't even really know what that is at this point anymore. What I will say, the other thing that I expressed was that this surgery has been very painful, more so than any really of the other surgeries. I will say that the surgeon addressed this right away and said she was not surprised. My incision is lower on, basically in the middle of my rib cage, it feels like. It may not be that low, but it's a lot lower than where your breast normally is. And I think that they pulled that skin to try to latch onto healthy skin away from the original incisions. She called it referred pain and was not surprised. She said that that makes sense, that it's probably so painful because everything that would normally take place up here is now being referred down. I guess I'm not a doctor. I'm just going to go with her on that one. But when they removed the dressings, I have the blue stitches, the hard's not the right word, the normal old school stitches. They're not the dissolvable sutures or anything like that. I have real thread. I say that because the first couple of surgeries, they were the dissolvable stitches. We're no longer doing that because we've had so many issues with healing. So I do have those stitches. They removed the bandages, and from what I have not looked at them, like the incisions. from what they say, this is the first time that I have not had black after a surgery. So there is no, which is that necrosis, that it raises the necrosis concern. So I don't have that. They are positive about the way that that is healing. They left the stitches, and I will have them removed next week, next Tuesday. And at that point, if everything looks healthy and there aren't any signs of the necrosis or the poor healing or any of that, they're going to let me call the radiation oncologist and set up the time to start radiation. Now, depending on, they're also going to fill that side a little bit. They have not filled my other side, mainly because I haven't let them, because I don't want such a disparity in my side, like how they are. So I'm sure we'll talk more about that next week, but they are going to fill it a little bit. Right now there's nothing. It's just flat. Not even air. So it's just flat. So we'll see how that looks. I think at this point, the game plan from the plastic surgeon standpoint is if it heals next week enough where we can schedule the surgery, whenever I can get it scheduled, and as long as the radiation oncologist is okay with it, we're going to go ahead and do the setup. Now, once I have that setup appointment where they go in and they mark you for radiation, I can't get filled anymore. So depending on when that appointment is scheduled will be dependent on how much I actually get filled prior to radiation. So I don't know what that looks like. I mean, it's been, if you've been following along, you know, I'm way over the time that they wanted me to have radiation. So they might fit me in, you know, a week later, and I may not be able to be filled anymore. And then I'll have to go and get filled after radiation, and we'll see what happens. So I don't know. At this point, we need to get radiation scheduled, and I know that doesn't make me happy about it, and that's okay. But that's where we are right now. So I think I'll learn more next week on the radiation side, based off of what the healing shows. So I guess at this point, I'm just asking for prayers that Tuesday shows everything is good and they can remove the stitches and I don't have to have another surgery. You know, that surgery would be a big one because they would remove both expanders and I would just be completely flat, and it's like we would have wasted all of these months for nothing. But hopefully that doesn't happen, and we get some positive news. So I'm hopeful for that, and I think that we're on that pathway based off of the appointment, and that's what we'll do. Yeah, so that's where I am with the post-op. I'll film a video next week after I meet with them a second time, and then hopefully you won't have to hear me talk about surgeries again until I'm done with all of my treatment and I can have implants put in, and that's just a normal procedure. Hopefully. I don't think that anything's been normal, but hopefully that'll be the case. So yeah, so that's my short update this time. I hope that everyone is doing well. If you just found my channel, or if you haven't subscribed, I hope that you will subscribe and stay updated. And yeah, appreciate you. I appreciate everyone. I hope that you have a great weekend, and yeah, so stay blessed, and I'll talk to you next time. All right.